Hi, I'm Russ Waitman,
I'm Jim McClay.
and we'd like to welcome you to the Greater Plains Collaborative, our PCORI-funded PCORNet Clinical Research Network. The Greater Plains Collaborative covers a large section of the central United States, 8 states in total, with potential expansion, and we range from Texas in the south to St. Louis and downstate Illinois in the east, north to Minnesota and Wisconsin, and west out to the Intermountain region centered at Utah.
That's right, and we've been working on this since 2013, so we're 10 years into developing this network. And during that time, we have been able to collect a cohort of about 34 million patients and are currently involved in 12 research projects and have many prior research projects.
So as we introduce the Greater Plains Collaborative and its investigators and site leaders, I'd just like to tell you about Jim and my roles. I'm called the Contact Principal Investigator. So I oversee a lot of the contracting, developing partnerships with organizations, and then also the data infrastructure for the network.
Right, and we are at the University of Missouri as the central site for the Greater Plains Collaborative, and I am the Dual PI. And as a clinician, I oversee engagement of our various stakeholder groups. So we have a patient stakeholder group and engagement officers at each site. And then we have advisors, external advisors that help us navigate the program.
So we'll give you a little bit of an intro to the various parts of our campuses and organizations involved in the Greater Plains Collaborative. We'll start with the University of Iowa to our north, led by Betsy Krishillis. She's an epidemiologist by background, and they bring a lot of strength in terms of integration with the basic sciences, as well as Betsy's role is also with their cancer center in a leadership role. So they do a lot of work with us on harmonizing data to support cancer research and its intersection with pragmatic research. And we really have enjoyed collaborating with the campus up in Iowa over the years. Also, Lindsay Cowell is our leader at the University of Texas Southwestern Medical Center. That's in Dallas, Texas. And they excel over the years at data integration, but also Lindsay has a background in microbiology and the intersection of pragmatic research with translational bioinformatics. Following them, I'll introduce you to Jeff Van Wormer. Jeff Van Wormer is at the Marshfield Clinic Research Institute. So the Marshfield Clinic is an amazing health system in central and northern Wisconsin. And notably, often in their geographic region, they are the sole healthcare provider. So from a data perspective, they have beautiful information on their whole communities often. They also have, interestingly, dental clinics they run. So if there are investigators or people interested in studying the intersection of dental health and oral health with broader health, they're an outstanding institution to work with. They also do leading work in agriculture and farm health. Following Jeff, we have Brad Taylor at the Medical College of Wisconsin. That's based in Milwaukee, Wisconsin, a large urban area with a very diverse population, notably of African Americans on the north side of town, Hispanic populations on the south side of town, and a strong presence along the eastern part of Wisconsin. Strong research in areas such as hematology, oncology that are internationally renowned. Meredith Zozis is our leader in San Antonio. That's the University of Texas Health Science Center at San Antonio. She has very strong outreach to the largely majority Hispanic population in San Antonio, and also a strong community with a large veteran and a military presence. Dr. Abu Mosa is here at the University of Missouri as our site principal investigator. Long accomplished record here of data collaboration with Cerner Corporation, and also informatics and natural language processing and machine learning. Our next investigator that we'd like to draw our attention to is Jacob Keene. Dr. Keene is at the University of Utah, which is located in Salt Lake City. It collaborates closely with our other partner there, Intermountain Healthcare, which is also based in Salt Lake, but spreads throughout the Intermountain region. Jacob and Dr. Keene also, in addition to being faculty at the University of Utah, is also an investigator with the Veterans Administration, and their campus oversees, in partnership with the VA, resource known as Vinci. It's essentially the Veteran Administration's informatics infrastructure for supporting research on the veterans population with linkage to active duty military in the Department of Defense. So that's an interesting resource to be aware of when you look to partner with the GPC and PCORnet at large. As I mentioned, Intermountain Healthcare is also based in Salt Lake City, but expands throughout the Intermountain region, including states such as Idaho, Nevada, and increasingly Colorado. Dr. Kirk Knowlton is an experienced cardiovascular researcher and cardiologist at the University of Utah. And he and Ben Horn and the other teams have a very large health system that covers much of the Intermountain region. Similar to Marshfield, at times they are the only provider in their regions and create great comprehensive data on their populations. Abby Sidebottom is an epidemiologist at Allina Health, which is one of the largest, if not the largest, health system in Minneapolis, Minnesota. Brings a lot of depth in terms of clinical research as applied to hospitals and health systems, and brings a large population from the diverse metropolitan area in Minneapolis. Shravani Shandaka is our leader at the University of Kansas Medical Center in Kansas City. It's a health system that encompasses not only the Kansas City region, but has health systems now spreading throughout the state in Olathe, Hays, Kansas. Brings together also, in addition to many of our other places, a strong nationally designated cancer center, and also does leading work in informatics and population health. And then, based in St. Louis, we have Dr. Albert Lai, the Chief Research Informatics Officer at Washington University. Washington University and BJC Healthcare encompass a large portion of eastern Missouri and southern Illinois. They're a world-renowned academic medical center, very strong at basic science and its translation to healthcare. Of note, they have designated cancer centers, Alzheimer's disease centers, and an outstanding group of faculty and patient populations with specific focus on underserved African Americans surrounding their primary medical center on the central west end of St. Louis. I'd point out as well, Dr. Joyce Balls-Berry is also based at Washington University and is our academic lead for engagement. To our south of St. Louis, we have also the University of Texas, Houston. University of Texas Health Science Center at Houston is led by Dr. Elmer Bernstam, an internal medicine physician and informatician. And again, similar to San Antonio, has very strong outreach to the Hispanic population, but also other diverse populations in the Houston area, and also does work to cultivate research and clinical care delivery in the Rio Grande Valley on the border with Mexico. Finally, we have Dr. Carol Geary, a nurse and informaticist by background, who is based at the University of Nebraska Medical Center in Omaha, Nebraska. Their campus also has designated cancer centers and strong work on outreach throughout the state of Nebraska. So while they're based in Omaha, they have broad reach throughout the state, and also similar to Marshfield, are engaged in research involving farming and agricultural communities. In addition to our 13 health systems that compile over 30 million treated patients in the Greater Plains Collaborative, the GPC also maintains a unique resource, Grouse, which integrates that clinical data together with administrative insurance data from the Centers of Medicare and Medicaid. Notably, we have over 20 million beneficiaries of Medicare and Medicaid linked to the clinical data. This results in what's called a crosswalk population of over 5 million patients. This is very valuable for Greater Plains Collaborative academic medical centers because often the patients who come to see us for cancer care, for an orthopedic procedure, may not receive their routine primary care at a Greater Plains facility. Therefore, by having access to insurance data from Medicare and Medicaid, we can study more comprehensively the health care received by our patients. This includes understanding how they fill their pharmacy benefits. Do they receive home health supplies that helps us better understand disease progression, as well as long-term care and home health. So Grouse, as you're thinking about using the Greater Plains Collaborative, in addition to study collaboration on prospective recruitment, obtaining data sets and working with investigators for smaller studies, we do have a unique resource working with Medicare, Medicaid that allows us to look more comprehensively and completely at the care received by our patients. And now back to Dr. McClay.
The Greater Plains Collaborative is a member of the Patient-Centered Research Network, PCORNet, and as such is driven by the input from patients. And we always need to keep the patient voice at the forefront of what we do. And in order to accomplish that, we have a number of advisory committees, and an entire segment of our effort is devoted to engaging with the community and our patients. And such, we have each of our sites provides a patient engagement officer. So we have a committee of patient engagement officers that are the liaison between the patients and their health systems. And then each of the sites has a specific patient with lived experience in the healthcare system to serve as a member of our patient advisory committee. So the patient engagement officers and the patient advisory committee work together to help guide us in the sticking with meaningful and important issues for the communities. And we ask our investigators to engage with the Patient Advisory Committee through a process we call our Rapid PACE, our Patient and Community Engagement project, which is a 1-hour session where the investigators explain to a panel of patients what their investigation is and get feedback from these highly experienced and trained community members. As such, that is done at each of the involved PCORNet sites. So we also, on a national basis, have a patient advisory committee. The engagement process also reaches out to engaging our investigators and our scientific community. And as such, the Greater Plains Collaborative maintains what we call the front porch. And if you go to the Greater Plains Collaborative website, gpcnetwork.org, there is a option to engage with us, and it'll walk you through the various options for using the resources that are available. Well, thank you for your attention, and we look forward to working with you in the future and bringing the resources to bear to improve the health of our populations.
Thank you again.